Hi guys, welcome back. And I want you to listen it very carefully because it's very important. You need to understand that. See, you're opting for a stray or a special stray round. You need to understand that there is a cone is there, and there is a bad side into that. That is, if you allotted any seat, irrespective of your dream branch or what, if you allotted that, you need to take it. Otherwise, you will be debarred from NEET PG, and also you won't get any refund. This is both applicable for stray and the special stray round. So you need to understand that if you go into stray and special stray round, you should have a backup plan. Like if you allotted some seat, then there is no go back. And there is a solution is also there. Like if you want radiology and your rank is like 8,000 or 9,000, and you are looking for DNB or diploma or MDMS. See, what you really need to do, only radio should be picked. If you pick the other thing, general medicine or the derma, maybe in case if you get it, you need to go that. You need to go, you need to take that seat. Otherwise, you will be debarred, you won't get the refund. That is quite, bad. Bad part is there. So I want you to understand this video very well. And also one more thing I want to tell you, is it possible to get a clinical seat in anesthesia under 40k towards 41 or 42k? Yes, it is possible. You can see over here, last year in the special stray, the closing rank of anesthesia was around 42k, exactly saying 42,060 something. So this is the reality. Okay, so if you're going towards the stray or special stray, it's going to give you a lot of advantages. At the same time, you do have some kind of bad side is also there, like what I said. So I will tell you one more thing, that yesterday I got a message. I hope she got around 30 to 40k somewhere around rank, and she want OB gynecology, is under reservation category. So it's quite obviously that you will get it something in stray, in the mop up to stray, special stray, and also she want MDMS. So it's quite, if she is lucky enough, she will get it, definitely get it. So what she's telling is that she will go for stray and special stray while she is studying for the NEET PG 2025. So those who are looking for 2025 and your rank is like somewhere in the mid range, and you can try stray and special stray. If you're lucky enough, you will get somewhere. That's the reality. I'll tell you an example that in anesthesia last year for the DNB, I'm telling you about the DNB part today, because MDMS is like what I said it before. I made a video last few days back. So right now it's all about DNB, Diploma in National Board of Examination. There is a cons there that if you don't want to work in a medical college, you are willing to take a private sector. Even I think the DNB can work in government. I think other than the medical college, other district hospital, other setup, they can work it. So don't worry about that. When time came, they definitely change the rules and things. So if you're really looking into the a clinical seat with your rank, maybe a little bit lower than the usual one, then you can take the DNB, and that's the diploma is there. I only recommend diploma if you are taking radio diagnosis. For the radiology people, if you take diploma, you will get a fair amount in private and you can work well over there. Other subject, if you take diploma, especially DCH part, is not so much recommended because of lot of issues out there. You have to Google it, then you will understand that what are the issues with the diploma people. Most of the diploma people, after completing their degree, they used to take the MDMS because that's a reality. Okay, towards into. So let's talk about the dermatology at first. Last year, the round 1 derma was like a 2,279. This is for the general category. For the OBC, you can add like a 5k, SCST respectively, you can add on. Okay, so let's come to the general category, because this is an opportunity for you guys. If you really want to be smart in the allotment process, just use it. is really going to work. So in the round 2 it was like a 4,000. In the mop-up that was like a 7,000. So you understand the difference na. The round 3, if you go to stray and special stray, that will be some kind of difference will be there. So let's come to family medicine. DNB family medicine, something is very, you know, I don't know why people are taking family medicine, but it is one of kind of subject which is like an end subject where there is no future opportunity like a studies opportunity. Like if you want to settle with family medicine, you can, like a family physician, you can end up here. Like the family medicine, the special stray round was 33k. Even with the 30k you can get a clinical seat in general category. You need to understand that in the round 2 it was like 27k. So family medicine is on subject, it is towards the last clinicals, like we call like a last clinicals. The top is like radio, derma, general medicine is there, OBG, and then the last clinicals are there like a family medicine, radio, nuclear medicine. These subjects are like that. Psychiatry, Opta, ENT, this subject towards the last rank you will get it. I'll tell you an example that ophthalmology, the last year, the special stray round, I'm not talking about the stray. The stray, it was like a 30k. Even with the 30k, you can get a DNB opta. And in special stray, it was like a 38k, almost like a 39. The 39k in the special stray, you are able to get your opta in DNB. So what do you think about it? So use your brain. That's what I want to tell you. About the orthopedics, it was like, you know, getting to orthopedics, you need at least rank like 30k. In the specialist rate, you end up to 29,980 something. So even with the 30k, you can expect orthopedics, DNB orthopedics. DNB orthopedics is really good, better than some MD, MS in some law colleges. For the radiology part, it was like a round 1. It was like a 4,260. For the stray, it was went up to 7,656. And radiotherapy or radiation oncology, that is around in special stray, it up to 44,000. Even with your 44,000, you will get DNB in anesthesia and radiotherapy. TB, chest medicine and respiratory medicine. Okay, that is like in a special stray round, it will end up to 18k. Even with the 20k, you will get it. Nuclear medicine is some subject is like an emerging one. I will make a video on nuclear medicine because I'm really interested in nuclear medicine. This is the very futuristic. Both diagnostic and the treatment part is there, in which it is like a old radiology scenario is there. This is the future. Nuclear medicine is the future. If you really want to know, just go and search some videos there, because research opportunity, the scope, how they're dealing, actually it is like the physiological process we will understand about the disease, and the treatment part is also included that. So it's going to be an emerging, like a huge scope is there, 100% huge scope is there in nuclear medicine in future. And come to general medicine, is it possible to get a general medicine after 10k for general category? Yes, it is. If you go to special stray, up to 17k you will get it. See, in the stray round it was like a 13k. In the special stray it was like a 70k. Even with the 70k you will get DNB general medicine. It is a DNB. Okay, that will be in somewhere in the north state. You need to see the colleges also. Okay, don't think like you will get it in some good colleges or something like that. And for the OB gynec, DNB was like in the special stray, it was like a 23k, 23,490 something. So even with the 23,000, you will get a OB gynec in what? Special stray round. Come to pediatrics, it is like one of the, it's also an emerging branch. Too much of opportunities are there, in which the round 1 was like a up to mop up. We don't need to talk about the round 1, round 2. Up to mop up, it was like a 15k. Okay, and then in the special round, it was like a 20k. And you need to understand that there is some smart people over there used to sit and wait and take the special stray round DNB pediatrics in 20k. For those who with the 30k they allotted in the first round or second round, they missed this opportunity. That's what I want to tell you. Be smart. Be smart. Otherwise, this is the world. You need to understand that the opportunities are there, but you need to be smart in that. And for the psychiatry part, one subject which is like a DNB. I won't that much recommended because of some thing is there. You will understand that. Just again Google it. You will understand that part. Diploma part, DNP part is not working for these subjects because you need to get some exposure. You need to get some real-time exposure to these patients. For the psychiatry part, for the DNB, the mop-up went up to 22K. Possibly not that much good. Around it's okay, but come to pediatrics, come to general medicine, come to TB, come to radio, come to general surgery. The general surgery, the special round that went up to 25K. Even the round one was started at 18K. This is a DNB, okay, DNB general surgery. For the END, that was like a 34K in the special stray round. Even with a rank of 30 plus K, you can expect a clinical seat in DNB. In which round? In the stray and special stray round. If you're really looking for a stray round, I want to tell you, go for special stray. You will get more advantage. That is a reality. But you need to be very careful also. I won't tell you that please take it, because so much of there is a bad side is over there, in which if you allotted anywhere, you need to take it. Otherwise, you will be debarred. So like what I said, how to do, like while you giving the option, please be sure that the which is you need it. Please don't apply everything. What was one mistake I did, it was not a mistake, okay. I want some clinical, my priority was not Kerala, but while I picked that one, I accidentally picked one college which is near to me, like within a 10 kilometer. We have a medical college, so I thought, okay, it is very near to me. If I was sure that 100% I was sure that I won't get it. Even the last year the rank was bit good in there, so I thought I won't get it. So in that way I just give that option, but unfortunately what happened, I got it. I was so surprised when the result came. I looked into it. This medical college? No, I was not expecting. I was always, I was like, I was ready to go. See, I used to work in North Place, and I know that the result will come at October, around 50 to 60, something like that, October. So I thought, okay, I need to pack my things. I arranged almost everything. I completed work here. I thought, okay, let's go. Let's go to some place like Gujarat, Maharashtra, UP, Uttarakhand, or some in Madhya Pradesh or Telangana or some place like that. I looked some universities, some colleges, good for me, like some in government. I'm not looking for a private sector at that time because of so much of external factors there. I don't want to tell everything, but this kind of thing I want to forget. I want to forgive. So what really happened is that I gave almost all option. Like I was like, I want to go to Maharashtra or Madhya Pradesh or Telangana, or even I thought about Bihar, West Bengal. So this was my shortcut places. But when the result came, I was totally shocked that I got PG in Kerala. This is the reality happened in last year, and this is the magic of special stream. I'm so happy that I got a seat in Kerala, because Kerala is not like the college is very near to me, like a 10 kilometer only. And the second part is like I'm in home after many years. After my 12th, I guess this is the first time I'm staying at home after 2012. It's like almost like 12 years after I'm staying here for a couple of months. This is reality. So, and also I'm telling you that like parents are getting old, so I need to be here for some time. So honestly speaking, while I get the result, I was so happy. That is the magic of special stray that I want to share with you. Okay, so any more queries you have, you can ask. So one most important thing you need to understand, those guys are going for NEET PG 2025. You have a mid rank, right, like 30 to 60K, and you want a clinical. Please try the special stray round. There is another one round is there, sport admission. That is mainly for these people, like for the non-clinical subjects, especially for biochem, physio, pharma, anatomy. These subjects having that vacancy, they will give the, they will ask for the advertisement, like there is a sport admission there. in which some university, I guess in Rajasthan or someplace. Last year I got a message like for you don't need to pay any amount. They will pay you around 1 lakh stipend for physiology or something, but you need to understand that for the namesake, because they need students for their to get students for their admission and allotment process. They need students. That's the reality. So for running an institution, you need students, right? Without students, that will be an issue for that institution. For allotting fund and many things are there. So this is the reality I want to tell you. So use special stray round. I won't recommend stray. If you're really looking for a stray round, go for special stray. That's going to work well. Even with 44K, you will get anesthesia. Even with 30 plus, you will get opta ENT and radiotherapy and the subject. And for the under 30, 25 to 30K, you will get gynec, surgery, ortho. The subject you will get it. And the most important thing, under 10K or like 6 to 8K, you will get DNB radiology. This is also an important thing you need to understand. And also under 20K, you will get pediatrics in special stay round. I personally know student friend who took a DCH in second round. I told him that please don't do that, just wait, and he was very anxious and he wanted to take it because he's afraid that what will happen in the next round, that the seat will go on or something. It's usually used to happen, but you will understand that once the result came up. So he took the DCH in under 15K, something like that last year. But when the mop-up result came, when the special stray came, he was very sad, very upset about that scenario, because he is like he took it in the wrong side. See, there is some rules and regulation there, like for the free exit and everything. So I want to tell you that if your rank is a mid, please don't take in the round 1 and 2. At least wait for mop up. You definitely get it. This is for general category students. I'm telling you that this is the only option you have being in general category. Either you need to be like a less than 10K minimum rank, or you need a huge amount of money for private or the NRI seat, or you need to be a little bit smart. If your rank is somewhere between this range, if you act smartly, you definitely get something. That is the reality, and that's it. And any more questions, doubts you have, you can definitely ask. I got many questions, and like what I said before, honestly speaking, I'm trying to reply everything. So any more queries you have, you can definitely ask. Definitely you will get the help. Okay, and be happy. I know that you are waiting for a long, so just wait. Definitely it will start in this month only, so just hope for the best. All the best, guys.